Good afternoon, everybody. My name is Michelle Civello, and I'm a nurse practitioner at North Oaks Wellness Clinic. I have a clinic both here in Hammond and also in Livingston. Thank you for joining me today. Today we're going to talk about immunizations and why getting vaccinations are important. So one of the questions that I get from many of my patients is, why do I need to get vaccinations? And what is it that they do for me? And so we go into a conversation about why vaccinations are important. So the first thing that I tell them is vaccines are important and this is how they work. So you receive a vaccination, and that is either a virus or a bacteria in small doses, and what happens is your body starts to build up immunity to those viruses that were introduced to you. So as it does that, the next time that you're exposed to that germ, your body will not react to it in the same way, and that gives us protection and helps prevent disease processes from happening. As you may know, some of the common disease processes that have been virtually stopped from vaccines are polio, rubella, and measles, and that has significantly decreased mortality and death in individuals. So how do vaccines work? So they work by building up immunity in your system, and one important thing that you need to know when receiving a vaccination is that you really don't have complete immunity until 2 weeks post that immunization. So if you come into any type of virus or germ in that meantime, you could potentially have an illness. So just know that it does take 2 weeks for that protection to occur. So it looks like we have some questions coming in right now, and one of the questions is, which vaccines should I get? And there are a couple of things that are very important in determining which vaccines you should get. So I recommend that you speak with your primary care provider, but some of the things that could determine the vaccines that you need are your age, your lifestyle, your job is important, your health, and also if you travel a lot. And one thing that I wanted to mention is we do have a lot of travelers here in our area, and if it's not a common immunization that you may need, we do have an infectious disease doctor, Dr. Newman here at North Oaks, who does specialize in travel medicine. So we do have that service available to the community. So two things that I want to speak to are the Tdap, the tetanus, and the influenza, and those two are recommended for most people, adults.
The next question is, do I really need a flu shot? I have never gotten the flu vaccine and have never gotten the flu.
Okay, so the next question that has come in is, I have someone who is asking about the flu shot. They've never had the flu shot before, and they've never had the flu, so they're asking if it's important for them to receive that immunization. My recommendation is yes, you should receive the flu shot. The CDC says that everyone over the age of 6 months of age should get vaccinated for flu, and also for reasons that we've mentioned in the past, to protect yourself and also to protect the people that you work with and the family that you love. Although the flu shot doesn't always provide total protection, it's worth getting.
The next question is about the shingles vaccine. If I've already had shingles, should I get the vaccine so that I don't get shingles again?
Okay, so the next question coming in is about the shingles vaccine, and this is a hot topic right now. Within the last 2 to 3 years, there's been a new vaccination called Shingles that vaccinates against the shingles. So shingles is a virus, and a lot of people have come into contact with it. It was probably introduced into your body as the chickenpox, and so it's the same virus, but as you age and you become immunocompromised, stress, that virus can become active and create a rash, and that rash can occur it's what we call a dermatome, which is a nerve line. So anywhere that you have a nerve, the rash can develop. So in the past immunization was Zostavax, and that gave good immunization, but it wasn't as effective as the new vaccination Shingrix. Now, the difference between the Zostavax and Shingrix is the Zostavax was a single vaccination. The Shingrix is a 2-dose vaccination, and you would receive if you received your first dose of Zostavax today, then you would receive your second vaccination 2 to 6 months from the first vaccination. This vaccination you may not have in your provider's office, however, it is available at your local pharmacies.
The next question is, besides the flu, are there any other immunizations I should get annually as an adult?
The next question is, other than the flu, is there any other immunizations that I should get annually as an adult? I cannot think of any other immunization that you would need to receive annually as an adult. One of the other immunizations that I'd like to speak to is also the pneumonia vaccine, and there has been some new research and development in the vaccines that we're giving now. So in the past 10 years, if you received a vaccination for pneumonia, you've probably received the Pneumovax 23. That is our old pneumonia vaccine. Now, within the last, I want to say since about 2011 or 2012, and don't hold me to that date, but within the last 3 to 5 years, we have a new pneumonia vaccine called Prevnar 13, which gives not only a different immunity, but a little bit better of immunity. So there's a schedule with that. The CDC recommends that if you are 65 years old, the first immunization for pneumonia that you receive is the Prevnar 13. And then the schedule with that is followed by the Pneumovax 23 vaccine 1 year later, and that would give you protection from pneumonia.
The next question is, what vaccine should pregnant women receive?
Okay, that's a very good question. The question is if I am pregnant, which vaccine should I receive? And first and foremost, you should always speak with your OBGYN before receiving immunizations, but CDC recommends that you should receive the flu shot and also the Tdap, whether it's prior to or during pregnancy. This will give immunity to your unborn child as well.
Finally, our last question, how do I choose the right provider for my vaccinations?
That's a good question. So the question is, how do I choose the right provider for my vaccinations? I will advise you the first person that you should speak with in receiving immunizations is your primary care provider. They carry a good bit of immunizations in their clinics. Whichever vaccinations they don't carry, they can direct you to where you need to receive the immunization that is appropriate for you. So, in wrapping up for today's talk, if you have any questions about any of the information covered today, or you would like to schedule an appointment to establish or for a flu shot or wellness, please give us a call at 985-230-2778, that's in Tangipahoa Parish, or 1-844-227-8669 in Livingston Parish. And you can always visit us at www.northoaks.org for more information. Thank you, everyone.